Joining us now is Dr. Bayou Curry Winchell, a family physician and health advocate. Doctor, thank you so much for joining us. I don't know if you were listening, I was talking to Matt Rivers about me living there in Los Angeles for a couple of years. I mean, the air quality out west was already pretty hairy, right? But I want to talk about smoke inhalation. Can you explain some of the health risks when inhaling smoke from these fires, especially for those with underlying conditions? I mean, this really just kind of compounds it all.
Correct. When we think about smoke inhalation, often we're thinking, oh, it's not a big deal, but it actually is. It can cause really big issues, especially if you have any underlying health conditions such as asthma or COPD. So you really need to think about what ways you could protect yourself. How can you do that? Wearing a mask is essential because even if you're just going outside for a short period of time, that can really impact your overall health.
There's so many pollutants as well to think about, doctor, like your plastic and wood from these fires. I mean, that's going to be lying all over the Southern California region. What are some risks of prolonged exposure from inhaling just the residue of these pollutants?
Well, when you think of the materials that are used to build a home, they are not meant to be inhaled. And so those pollutants, toxins, as you mentioned, can be really irritating to the lungs. The other thing we have to think about is the long-term exposure. That can cause health conditions, not just in the immediate, but also in the long term.
Absolutely. So much to think about, and that's important to think about in terms of masking as well. Doctor, I do want to point that out. Thank you so much for joining us and all that you're doing to inform us. You can learn more from Dr. Bayou on her website, drbayou.com.